Hi, it's Christina with the Sisyphean Journal. Today is March 21st, and we're looking at something that we were told never happens. We're told that abortions past about 20 weeks are always just in the most dire circumstances, woman's health, baby's health. This wasn't the case. I don't know why 23-year-old Sherika decided to electively abort her 25-week baby. But she did. The documents are clear. She was 25 weeks pregnant, and this was a purely elective abortion done at Summit Medical Associates in Atlanta, Georgia, on March 21st of 2008. Now, Sherika had sickle cell trait along with low levels of hemoglobin in her blood. Only 7.3 when a normal range for an adult woman is between 12 and 16. But the abortionist, Tyrone Malloy, proceeded with the abortion anyway. While in the recovery room, Sherika went into cardiac arrest and was transferred to Atlanta Medical Center while EMS workers continued CPR. On arrival, she had a distended abdomen and vaginal bleeding, so ER workers called for a gynecology consult. Emergency surgery was performed to remove Sherika's damaged uterus and repair an injured bowel. Now, Malloy said that her bowel was injured during this surgery, not during the abortion. Now, after the surgery, Sherika showed symptoms of DIC, disseminated intravascular coagulopathy, a life-threatening clotting disorder sometimes caused by trauma or infection. Now, she was treated with blood products, but she died in the intensive care unit. The Georgia State Medical Board reviewed the case and determined that Malloy, quote, failed to conform to minimal standards of acceptable prevailing medical practice. He failed to follow the procedures, proper standards of care in the following ways. First of all, Sherika's blood count was low. And since this was an elective procedure, there was no medical emergency. There was no, oh, we have to end this pregnancy right now or she's going to die, in which case they would have done a C-section in the hospital and she would have been properly supervised through the whole thing. She should have been given a transfusion to bring her blood hemoglobin levels up to at least 9. Then blood clotting tests should have been performed prior to the abortion, and Malloy should have more accurately determined the gestational age of the pregnancy because the risk of amniotic fluid embolism, which can trigger the clotting disorder, increases with both increased gestational age and additional intrauterine manipulation, meaning you're poking around inside her uterus with instruments ripping the baby up. Malloy was reprimanded, ordered to pay a $10,000 fine, and to take continuing education classes. He was allowed to continue to practice medicine in general and abortion in particular, but eventually went to prison for Medicaid fraud. So he was not the most wholesome individual in the world. But there goes the idea that these abortions are never done electively. They're always done in only the most dire of circumstances. I really wish Sherika had gone to a pro-life center and they would have helped her have her baby, and both she and her baby would be alive today.